Hi everyone, it's board certified plastic surgeon Sean Doherty from Boston, and I wanted to speak today about the recovery process for a gynecomastia procedure. So gynecomastia, as you may know, is fullness of the chest in a man that's dissatisfying, and it's likely secondary to excess fat and gland. So a surgical procedure usually involves a combination of liposuction and then surgical removal of that gland tissue, which is through a periareolar incision. It's done in the operating room, usually with anesthesia. It can take me about an hour and a half to 2 hours. So it is done as an outpatient, so a patient goes home that day, and then is the recovery process, and that is what a lot of patients have questions about. There may be pain, soreness, and achiness to the chest for the first couple of days, and I recommend limited activity and potentially pain medicine for a day or so. Compression is a huge part of recovery, and I feel that patients who are most compliant with compression get, in theory, the best results. So stage 1 of compression is the first 3 weeks, and that is a garment that you're wearing 24 hours a day, except for showering, to help decrease the swelling and contour and shape the chest. This is extremely important. So this is what the stage 1 compression garment looks like. So again, wearing that 24 hours a day, except for showering. And for the first 2 weeks of that 3-week period, you're wearing foam, and that goes underneath the garment in the chest to help contour the chest and help recover it. So after 3 weeks, you transition from a stage 1 compression garment to a stage 2, which is a lot easier to wear under clothing and feels a lot more like normal clothes. So activity is also curtailed during the recovery process. So for the first 2 weeks, you're up and walking around, but you're not doing anything that's excessive or aggressive, really anything that is considered exercise. I want you up and moving, but nothing aggressive. So starting at 3 weeks, I let my patients do a little bit more cardio and core. And at 4 weeks is when guys can get back to upper body. So that includes daily activities around the house, but then also in the gym. So I do feel that my patients who are most compliant with the recovery process feel better and then ultimately get the best results. So I hope this was helpful to you, and if you're considering a gynecomastia procedure, please reach out. Thanks.